Hi, I talk about female infertility. Female infertility may be defined as the inability to conceive a child on the part of the woman even after year time period, or the inability to carry through pregnancy to its natural.
Female infertility. First off, let's explain the question on everyone's minds. What is female infertility? Well, someone is considered infertile if she has a hard time conceiving or staying pregnant. If a woman has tried for a year or more to get pregnant and is unable to, she is considered infertile. 30% of women's infertility is caused by ovulatory problems. Ovulation is when an egg matures and begins to travel along the fallopian tubes to the uterus. This process is more commonly known as your cycle, your period, or that time of the month. 70% of cases of ovulatory problems can be treated by the use of drugs by a physician. Failed ovulation can be categorized by hormonal problems, scarred ovaries, premature menopause, and
Cause of female infertility: ovulatory disorder, polycystic ovarian syndrome, premature ovarian failure, fibroids, uterine factors, and endometriosis.
scarred ovaries. Extensive, invasive, or multiple surgeries for ovarian cysts can cause the ovarian capsule to be damaged. Therefore, follicles cannot mature. Premature menopause. Some women cease menstruation and start to go through menopause earlier. Their eggs are depleted and usually occur in athletic women or women with low body weight. Follicle problems. Unrupted follicle syndrome is when every month a woman produces an egg, the follicle fails to rupture. The egg stays inside the ovary, resulting in improper
Application in medicine: medication treatment for female infertility, surgical treatment for female infertility, intrauterine insemination, in vitro fertilization, don't smoking, and don't drink alcohol.
With in vitro fertilization, which is sometimes known as the test tube baby technique, the ovaries are first stimulated with hormones so that they produce several ovarian follicles. Before physical ovulation takes place, but after oocyte maturation is initiated by the administration of a further hormone, the follicles are aspirated. This means that the follicular liquid and the egg it contains are extracted with a needle. This is performed under sedation in a short outpatient procedure, with the doctor using transvaginal ultrasound to check the proceedings. In the lab, the eggs collected in this way are brought into contact with sperm cells, which have already been cleaned and concentrated. The eggs and sperm cells remain in an incubator set at 37 degrees centigrade for 24 hours so that natural fertilization can take place. During this process, one of the many sperm cells will find its way into each egg. Once fertilization has happened, at least one living embryo that has already divided itself into 4 to 8 cells should have developed. 1 to a few days later, one or more embryos are transferred by means of a thin inflexible catheter to the cavity of the uterus, where the embryo can embed quite naturally.
Advantage and disadvantage. Disadvantage: they are very dangerous. The women are not made. Women develop feeling of guilt for not being able to have children. An advantage: there are some treatment for avoid the infertility. Women wouldn't have unwanted pregnancies.
and I want to talk to you about a book that I've written called Facing Infertility, A Catholic Approach. If you are struggling to conceive a child, then you already know that the pain is physical, emotional, and deeply spiritual. But even if you aren't struggling with infertility, chances are you know someone who is, whether you realize it or not. Infertility affects 1 out of 6 couples at some point during their marriage. When my husband and I were ready to have children, we couldn't conceive. Like so many other couples, we spent each month waiting, hoping, and praying for a child that we feared we might never have. The emotional roller coaster of infertility can be overwhelming. It's normal to go through feelings of denial, shock, anger, desperation.
Disease: polycystic ovarian syndrome, premature ovarian failure, fibroids, endometriosis.
Endometriosis is a prevalent, chronic, and debilitating condition affecting about 1 in 10 women of reproductive age. There are many symptoms of endometriosis. The most common are dysmenorrhea, dyspareunia, and pelvic pain. Symptoms often vary and may differ from patient to patient. This is complicated further, as symptoms caused by endometriosis are easily mistaken for those of other conditions. A definitive diagnosis of endometriosis based on symptoms alone can therefore be difficult, leading to an average delay of 8 to 10 years in reaching a diagnosis. Endometriosis is characterized by the presence and proliferation